Hello, welcome to the Enhancing Clinical Practice stream of the Snomed CT Expo 2020. My name is Nikki Ingram and I'm a Senior Terminologist at Snomed CT. I will be moderating today's session. Please use the Q&A box to type your questions to the presenters. Questions will be answered at the end of the presentation. I'm now pleased to introduce Paivi Piirainen, who is a health informatician, and Rikard, Lovstrom, a medical expert, both of whom work for the National Board of Health and Welfare in Sweden, and who will be presenting National Code Index for Chief Complaints. Paivi, please proceed.
Hello, welcome to our presentation about National Code Index for Chief Complaints. I am Paivi and I'm a health informatics professional and I work at the National Board of Health and Welfare in Sweden. Let's talk a little bit about chief complaints. In this context, chief complaints are the patient expressed reason for seeking healthcare. They can be entered by patient directly or transcribed by healthcare professionals. Transcribed chief complaints should be as close to what the patient expressed as possible. This allows integration of patient participation in a meaningful way. Now over to Rikard.
Yes. So the first step is to choose the chief complaint for the patient, and we do not mix this up with the healthcare deciding the reason for encounter. So we try to keep these two separate. The first step is to really express the patient's complaint in the patient's language, and the other is to continue with the reason for encounter, which the healthcare decides. So our key question here is to express this in a way that the patient should be able to describe it. So for instance, if we have an X-ray investigation, it might be the patient's word and not the healthcare wording of this. So, and when we look at the process, it's usually that the healthcare, the patient makes contact with the healthcare and expresses this chief complaint. It could also even be by a bot that puts questions to the patient, and this chief complaint is then sorted out and assigned to the documentation. Later on in the process, there might be new chief complaints as well, but if you have an encounter where the patient doesn't feel the need to update its chief complaint, it is just conveyed further, and the healthcare assigns reasons for encounter for the subsequent encounters. So next.
And now we'll discuss our ongoing project. In 2016, our project started with a simple question. Would it be helpful to identify and track patient chief complaints? We started gathering relevant information and conducted a needs assessment, and that led to a governmental mandate supporting the creation of a national code index for chief complaints. We reviewed multiple sources of information to consistently create descriptive reasons for patient encounters. Then we were able to collaborate with expert groups to formulate patient-friendly descriptions and mapped those to Snomed CT concepts. And this is how the content looks like in our code index. The code index is presently comprised of 216 layman's terms, which are included in Snomed CT's Swedish edition. Content includes signs and symptoms, patient-initiated procedure requests, all in the context of patient-expressed reasons. The code index doesn't include any diagnosis or specific activities like MRI and health certificates, etc., that the patient wouldn't request without experiencing the actual chief complaint. In November 2020 marks the first release of our chief complaints reference set. And here in Sweden and internationally, there are similar code indexes already. For example, in general practice and family practice, there is a reference set in Snomed CT that includes reason for contact. However, they are more expressed from the provider perspective, and they don't seem to be the patient-expressed perspective. And what our goal is with our chief complaints is to allow the patient-expressed complaints. In Sweden, we have also RETS, a code system that is used by ER and paramedics, and it is currently not adapted for use as a patient-centered process. And now back to Rikard again.
Thank you. So some examples of how we could use this and what kind of use cases we have thought of. So one is of course the one I mentioned. If you make contact with the healthcare and you have you want to express your need, you could add this information in some kind of self-service or booking service, and you could also in the EHR system have this as an initial sort of labeling of the case the process that you are proceeding with within healthcare, and this initial placeholder could be something that continues within the process or is updated during the process. And when you are perhaps hospitalized and then discharged, you can revisit your initial chief complaint and just sort of make a conclusion of how it all began and how it is now, how it has proceeded. And we also see this as an important information if you want to gather information, follow up information, make statistics, and also see how you can gather data to extract knowledge in the hand and see how you can perhaps both improve the process and the guiding of the patient within this process, and also in general make more initiated decisions during the healthcare process. We also believe that this will be an important piece of the puzzle when we discuss research, not only for because in particular when you have the pre-hospital and the early hospital processes and the early primary care processes, sometimes you don't have a concluding diagnosis and so in the initial stages, and in that case it might be very helpful to at least to have the chief complaint to attach this information to and analyze it. So we are providing this code system as a reference set, and it will go live shortly in this coming release. And we have both the ref set as it is, and also we are planning a language ref set to have synonyms in layman terms to make this easily to navigate in for the patient to choose the chief complaint. So with this, we conclude this presentation, and we are happy to answer any questions. Thank you.
Thank you very much for your presentation, Paivi and Rikard. Can I ask the attendees give us a moment while we switch over from our pre-recorded content so the presenters can address the questions you've been submitting live? Please note this session will be available on the event platform for the next 3 months. Thank you. Hello, thank you to our presenters, Paivi and Rikard, for the discussion, for sharing with us. And now we have a little bit of time for some questions and answers. I think you're both available to answer some questions. I'll look at my list. Some interesting questions have come in. Which areas of use are relevant for the Chief Complaints Code Index?
Okay, I can try to answer. Do you hear me? Good.
Yes, I do. Yes. Thanks.
Which areas?
If you can jump in, or you or Rikard can jump in on that one, I'll open it up. Which areas of use are relevant to the Chief Complaints Code Index is the first question.
Yeah, you can use the code index in a systems for when the patient is seeking for healthcare via a digital platform, or well, the healthcare register the patient's demand for healthcare. And the point is that you can use the code system in different systems, and you don't need to use free text.
Thank you. We have some live questions come in. Can we have some examples of the layman's terms? That's Christopher's asked that. If one of you want to jump in. Some examples of the layman terms, the sort of words that would be used.
Yeah, for example, you can tell that you have stomach problem or problem with your hand. Rikard, do you want to proceed with something?
Well, we have the terms we have used have been in Swedish, so
yeah.
I try to think of some English translations here, but I mean insect bite or pain in different locations. So I mean, the code index is filled with 215 terms. So maybe we should have checked the English ones. Sorry. But specifically, I mean, it's for the first encounter, the first contact with healthcare. So it is all what's on the top of the mind for the patient.
Thanks, Rikard. I like this question. I don't know how many of the concepts exist in Snomed? Andrew Perry is asking that in the Q&A. don't know if that's one that you would know.
Well, the majority, but I don't remember how many we needed to make in the Swedish extension. Do you remember that, Paivi?
It might be something 80%, probably. So it's maybe we have 216 terms, so 190 maybe. I don't have the exactly details about that. But we needed to create new Swedish concepts.
For maybe 20, 30 concepts then.
Yeah.
Okay, thanks very much. If anyone wants to ask a question, please just type it into the Q&A. I have a list of questions. How does the Chief Complaints Code Index influence the patient care process or patient care management? If one of you...
It is influencing this in at least two ways. One is to give an initial label for a problem that is maybe not fully understood or diagnosed. The second use is that we have a number of knowledge resources where this knowledge resource has a label that corresponds to the chief complaint. So if we understand the chief complaint, we know where to look for in the knowledge resources and how to proceed there with checklist questions and things like that. So there are knowledge resources connected to this index.
That's very useful to know. Thanks, Rikard. A live question's coming from Natasha. Did you have patients reviewing these chief complaints? That's a good question.
We use some experts that are near contact with patients, because in Sweden we have already platforms where patients can register their chief complaints. So in that way, we get the patient reviews also.
And these actors, they are receiving patient expressed descriptions of their problems and are sorting them up. So they have been part of the expert group where we have sorted out which complaints are needed. So they have the raw data for how patient describes their problems.
Thank you. That's quite clear. Have there been any other countries from which you've drawn any inspiration for the project regarding chief complaints?
We used ICPC2 somehow, so it's still more expressions that are used by professionals. But I know that in Finland they are doing this kind of Snomed job also. So we have followed that.
Thank you. Now I have a list here. So can a documented chief complaint develop into a diagnosis later on in the patient care process? If one of you can jump in on that one.
Yes. So, I mean, sometimes the chief complaint is actually the same as the subsequent diagnosis. Like if you have a headache and maybe the diagnostic process doesn't enter into any more specific headache than the actual symptom diagnosed chapter in ICD-10, for instance, so that there's a code for headache there as well. So sometimes there's a symptom-based diagnosis which you could land into, but other times you might have perhaps an abdominal pain as a chief complaint. But already when you discuss this with the first healthcare professional in their contact, they might decide that, oh, but your pain is going up to the chin and out in the left arm. Maybe we should actually have the reason for encounter should be maybe your chest pain. This is what we should try to rule out a subsequent myocardial infarction, and maybe that will be the subsequent diagnosis. So you could either have the chief complaint as a support for subsequent diagnostic process, or you could have it as a convenient label for the patient process. For instance, many times you don't know the diagnosis to begin with, so you might need to start with expressing the chief complaint as a labeling of the process.
Thank you. That was a really full answer. Just checking the list. We've had a new question from Mikko, who's from NRC Finland. What kind of feedback have you received? Any best practices about your project? And earlier he'd written that in NRC Finland we have translated core problem list into Finnish with professional and consumer friendly terms. So can I ask, what kind of feedback have you received?
Feedback has been good, but sometimes different actors, they miss the healthcare point of view. They would like us to also proceed with the professional terms also, as they did in Finland actually. So that's one feedback. And any best practices, Rikard?
Well, I mean, since this has not been fully implemented in a number of systems, it's still on sort of a discussion stage where the actors working with this kind of appreciates this code index, but they have not reached very much experience up to that. They have been expressing that this is a nice picture of I mean, it's a nice sorting of a reasonable amount of codes. I mean, 216 is a reasonable amount of codes. It has it's not too big, it's not too small. It's reasonably fine-tuned to get the concepts that we are interested in, and it's also reasonable to look at the knowledge resources I mentioned, because the knowledge we are conveying is sorted out in topics that has a coverage of this size. So all initial feedback has been good, and they have been partly, we have adjusted accordingly to this feedback. But a broader use in practice has not been done yet. So we are still waiting for, I mean, guidelines to be able to formulate even better guidelines.
Yeah, and we will release in November, actually. So next year, Snomed Expo, then we can probably tell the experiences.
Yes, but maybe actors have, some actors, the key actors have already received versions of this. So it's, yes. I mean, the release you're mentioning, it's the release through the Swedish edition when it's publicly released in this coming November release. So yes.
Just a couple of final questions. You've almost answered it there. Will the rest set be available for international use?
We have been discussing if there's an interest, we should proceed with suggesting these these lacking 20 or 30 concepts to the international edition. So even this meeting here is sort of a question to our audience if this is of interest.
And finally, just what are your thoughts surrounding future developments and management needs in relation to the Chief Complaints Code Index?
It will most probably be a maintenance. It will be maintained in Sweden at least. So, and if we can broaden this to the international level, we would just be happy. We would be happy to assist in this.
Paivi, do you have any final thoughts on the future developments and management needs?
Yeah, we will look forward about all the opinions and questions that will come. So, and we will try to develop the code system to good direction when people start working with that a little bit more, so we will know more about that.
Thank you. I think we're going to wrap up. There's a final question about, I'm not sure if you know about the Swedish National Medical Helpline. Will it be used in that context? But I know you'll be available for more questions if
those are the one of the main actors we are talking about. So they have a very similar setting of codes already, and they are using this knowledge resource we are talking about, which is a national resource and also openly available. So as open sort of open data available, but you need, of course, the applications and the logins and etc. But a number of, not only the helpline, but also a number of healthcare units, healthcare centers, or outpatient clinics, etc., are using this knowledge resource and using the almost similar to this code index, and they presumably will be adapting to this new version, which Paivi and I have been working with, because they have been, pushing for these for the changes that we have made to the code index.
Well, thank you both very much. It's been a really interesting discussion, and thanks to everyone for their great questions. And enjoy the rest of the expo. Thank you.
Thank you very much.
Thank you.
Bye.